Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Almost everyone has heard of ADHD, Attention Deficit Hyperactivity Disorder. It makes people think of kids who have trouble paying attention or who are hyperactive or impulsive. I think I was like that as a kid.
Maybe.
But it's not just a problem for kids. About 4 to 5% of the U.S. adults have it, and that's about 8 million people.
I identify very strongly with this topic. Let's just say, here's the problem. Not many adults, less than 20%, get diagnosed or treated for it. And that's unfortunate because in addition to causing trouble in your daily life, your work, and your relationships, ADHD can cut an estimated 8 years or more off of your life expectancy.
Surprising.
Really shocking. To learn more about adult ADHD is family medicine physician and ADHD expert, Dr. Bob Wilford. Welcome to the program, Dr. Wilford. It's nice to meet you.
It's nice to be here. Thank you for having me.
You know, Dr. Wilford, I would say that most people, including myself, are sort of surprised to know that 1 out of 20 adults in this country has ADHD.
It's not the kind of thing that you talk about when you're meeting your friends for lunch, though, is it? And you, Dr. Shives, are a successful man. I'm suspicious that perhaps ADHD doesn't show itself very commonly in the circles in which you run. And so unless it's something that we look for and seek out, it's pretty easy to miss.
No kidding. Well, does everybody who is diagnosed with ADHD as an adult did they have it as a kid?
By definition, so ADHD is a neurodevelopmental disorder. A person who suffers from that distractibility, that impulsivity, was born that way. It's not a behavioral choice. It's not a result of their parenting. It's not a result of any habits that they might have grown up with. So they came out of the womb with ADHD, and it's been with them 24/7 since. There are some adults who from time to time feel distractible. And of course, there's so many things that go on in our lives or other medical problems that sometimes we forget the name to somebody that we meet in the hallway or miss an appointment or fail to complete an obligation on time. It's not always ADHD because of the way our lives are chaotic.
But there's a certain number of kids who actually outgrow ADHD, right? And do not have it as an adult, or no?
Not nearly as many as was once thought.
Really?
It had been told to parents for a long time that, Johnny's having trouble in 4th grade, but he'll be a great adult. And he probably was, but he's probably a great adult with ADHD. Yeah. So what happens is the hyperactivity that those kindergarten teachers are dealing with tends to fade away with time. It takes a lot of energy to be hyperactive. And as a guy in his 40s, I can't maintain that, right? But the impulsivity and the ups and downs of emotional dysregulation persist. So I might not fidget as an adult, but I might not finish the bathroom remodeling project that I started 6 months ago either.
You just learn how to kind of work around the ADHD that you have and grow up learning tricks and tips on how to get around them. Or you don't, and your bathroom goes unfinished.
So it's estimated that 1 out of 7 or 1 out of 8 children truly outgrow the condition. They're able to learn sufficient coping mechanisms that as an adult, no symptom would be discoverable. But that means 6 or 7 out of those 7 or 8 continue to have symptoms that are discoverable in adulthood. And for many of them, they find ways to cope. They're good at using Post-it notes and trapper keepers, or they marry someone who's a little OCD, and that kind of helps them out a little bit.
Counterbalances it. Huh?
But for many, they don't find that way. And so it won't be hard if you think of that mental Rolodex you have to think of acquaintances or family members who bounce from job to job after 6 months at a new place, just as most of us would be kind of getting into a rhythm of the workplace. They're bouncing out. It just didn't work out for them.
When we used to think that it was 50 or 60% of kids who outgrew ADHD, you're saying that's not true at all.
It's not true at all.
We answer here about ADHD, men and mental health, men and health book ADHD is one of the most common neurodevelopment disorders in childhood. It is usually first diagnosed as childhood and it often is into adulthood. Child with ADHD may have trouble paying attention, controlling impulse behaviors, may act without thinking, results in overactivity. Men do not like to know they have ADHD. A lot of people that have ADHD may have schizoaffective. This is not according to this book. I can't take an ADHD medication because it is stimulant and makes me have anxiety. The combination of psychiatric and ADHD medication is not the best medication. It can cause problems with ADHD, although others, obviously, they're good for other people. The medication can help with impulsivity. Also, talk therapy. If you have a mood problem, you may be suggested to mood medication. CBT helps kids with ADHD, goal-based personality. I losing my stuff, paying attention. Do you remember? I should. Thinking process to the book. Think, feel, do. Different mindsets for ADHD. I also thought that ADHD was a learning disability. It turns out it is not. It is a mental health disability. Men like to fix situations, which is why they don't have like ADD. Men cannot fix it. Sometimes men do not think about their decision. Men can help regulation things by being patient. Things can take a long time to learn. For example, wake up after brushing your teeth. You need to change these habits so they can become that easy, but work on one habit at a time. Any changes for behaviors, what's going on, require you to quit one thing. It takes about 12 weeks to develop a habit. Daydreaming, forgetting lots of things, squirming or fidgeting, talking too much, make mistakes, or unnecessary risk, having a hard time resisting temptations, having trouble taking turns, having difficulty getting along with others. That's something you may look for ADHD. There are 3 types of different ADHD depending on the symptoms. Strongest are individual.
Predominantly inattentive presentation.
It's hard for individuals to organize or finish a task or detail or follow instructions. The conversation person easily or forget daily routines.
The person fidgets and talks a lot. It is hard to sit still for long, e.g., for a meal or while doing homework. Children may run, jump or climb constantly. The individual feels restless and has trouble with impulsivity. Someone who is impulsive may interrupt others a lot, grab things from people, or speak at inappropriate times. It is hard for the person to wait their turn or listen to directions. A person with impulsiveness may have more accidents and injuries than others.
This is called predominantly hyperactivity impulsive. Combined presentations, symptoms of the 2 types are equally present in the person. That's for ADHD. Now on to the MLB draft. The Royals, Cardinals, and Cubs and White Sox will go over their picks. Blake Mitchell, catchers, high school, Royals. Waters, high school, Royals. Pick 75, Higher Rato, high school. My problem with these picks is they're all high school picks. We'll talk about that more later on our show of Royals problems. Continue through the off season on the Royals show of what I think of the assessment of the Royals. Cardinals, Chase Davis, outfielder. 3rd round, Honeyoke. For more, visit this website. Cubs, Matthew Shaw, Maryland. Pick 68, Jackson Wiggins. Pitcher, Arkansas. Pick 81, Josh Rivera, shortstop, Florida. For more, visit this link. White Sox, no first round. Grant Taylor, right-handed pitcher. LSU, Seth Keneal, right-handed pitcher. Wake Forest. For more, visit this link. This is Sam Vaughn for Sam Sports Report.